na nilikuwa na uchungu wa matibabu. Mungu alisikia kilio changu na Mungu akanipea nguvu, na nilikuwa na imani sana. Kitu nilikuwa nayo inaitwa imani. Mimi hata ningeenda mahali kwa choo kila saa, nilikuwa ni imani. But wakati nilifanywa radiotherapy, nilikuwa na shida mahali ya vidonda. Nilikuwa na vidonda kila mahali kwa wakati, nilikuwa na vidonda. Nilikuwa na uchungu sana. Nilikuwa na uchungu ya ugonjwa na nilikuwa na vidonda. But nilikuwa na imani sana. Imani kitu ya maana, imani iliniponya. Sasa niko sawa, naenda kliniki, niko sawa. Namshukuru Mungu, niko watoto wanne. Last born ako form 4, namshukuru Mungu, naitwa NMCS.
Kwa majina naitwa Inyangala Dennis. I'm a pathologist by profession. I also want to take this opportunity to thank you for the invite to come and interact with this. A pathologist diagnoses diseases, injuries, or causes of death. In my field of work, I think 90% is diagnosis, because you're also the doctors who, when a sample is taken, like a sample in units alichukuliwa, your nyama when you're surgery. So all surgical samples usually come to us for us to give the name of the deceased to the doctor when they're treated. So when the disease is limited within the organ, let's say it's your uterus that has cancer. If it is limited within that organ, it can range from stage 1 to 3. Stage 4 means imetoka kwa hiyo that organ imeenda another organ that iko bad nayo. So ile imekuja kwa damu, ama imekuja kwa lungs, ama imekuja kwa liver, an organ that is not anatomically close to it. So that is why for stage 4 is usually a bit bad because the treatment is more intensive. If it is chemo, you're given even more huge doses. Most of the time it usually requires chemo. Chemo is not a very good treatment. Chemo is one of the treatments that squeeze it out. These days usually have better treatment. So, but for someone who's in stage 4, they usually have to undergo chemo. And maybe and radiotherapy about it. So that's what makes stage 4 a bit bad. So stage 4 difficult to treat, the outcomes are a bit poorer, and definitely inakuja pamoja na symptoms. But if you embrace screening, first of all, even the symptomatology will not even be there. So that's why we usually advocate for yearly screening for someone who from 16. Why from 16? One of the risk factors and the main risk factor for cervical cancer is sex. So why? Because HPV is a very prevalent virus. It's almost as prevalent as H. pylori at all. So almost everyone has HPV. Now, so definitely the earlier you start engaging in, especially protected sex, the more the risk comes with time. If you embrace screening, you catch the disease earlier, and treatment is a bit safer. And then the goodness with screening, when we screen you, like when we screen you, if we screen you today and practically you are negative, the chances of you getting malignancy are almost around 20%. Like you can actually give you a clean bill of health and convey this year and the next year. So that's what we encourage, and that's what Mom preaches through Lady Hope, that we embrace screening.
Good afternoon. My name is Kate Maggie from KISS University. I have 2 questions, and my first question is this, I don't know if it's a fact or a stereotype, that breastfeeding reduces chances of being diagnosed with cancer. So I need a doctor to clarify that.
Thank you for that question. So I don't think it's a myth. It's actually a fact, but not just any cancer. It's a fact on breast cancer. So what happens for your breast cancers? The biggest impetus, the biggest fuel that fuels breast cancer is your hormone called estrogen. So when estrogen, you're exposed to estrogen for a long period. That's why breast cancer is a disease of around the mid-40s. So the reason why that's the commonest age, the peak age, is because let's say most ladies will start their menarche at around 15. Menarche inamaanisha kwanza your periods. So the moment you start your periods, then you're exposed to estrogen. And because cancer is a slow-growing disease, that's why the constant exposure to estrogen over those years then would predispose you to getting cancer. I'm not saying predispose you. So how does breastfeeding come in to protect you? One of the risk factors of breast cancer is someone who started their menarche early. So meaning they've had a long exposure to estrogen. The other risk factor is someone who has never been pregnant. So how does pregnancy and breastfeeding come in to sort of reduce your predisposition to breast cancer? When you're pregnant, you don't have estrogen because you're no longer in the cycle. So for 9 months, you're off estrogen. Or at least you're off the exposure of estrogen because sababu progesterone imepanda kabisa. So it's counteracting your estrogen. And then remember, when you're breastfeeding again, you're not back to the cycle, because sometimes some people take around 6 months, wengine even up to 3 years. Hajarudi kwa cycle yake. So within that framework of around 3 years, you off the fuel that could predispose you to breast cancer. Now, so let's say someone who's had, let's say, 5 babies, 5 different pregnancies. You're looking at around almost a decade of being off this fuel, as opposed to someone who's never been lucky enough to have a baby. There will be a higher risk of getting breast cancer.
And my second question is, what advice can you give someone who has fear of screening? Maybe this person has fear of getting the outcome. Yeah, thank you.
But it's just, it's a matter of weighing your risks. So that, would I want to know this thing earlier and take care of myself? So I know it's difficult. We need, and that's why we need a lot of government support for information that screening does not confer to you a risk. It actually confers to you a benefit.
To pass question number 2. The question number 2 was that can cervical cancer lead to fibroids? Question number 3 is to mom. Is Lady Hope open to, like, let's say, partnership?
Fibroids and cervix, 2 different diseases.
Okay, the question directed to me is whether we'll welcome partnerships. This one, I can say a big yes. Big or small, partners are always welcome, provided we protect our patients. I'm very, very keen about patient information, and if a partner is coming in a big way, I should first know whether they respect the patients. For now, we have many patients, many partners, but in small ways. Like the Osho Academy, we have a partnership the last 5 years, whereby in October, they have a day they call us for cancer awareness, and in return, they fundraise for us. They call it Pink Day, where they want more information about breast cancer, where they call upon their friends for a bake sale, and they sell small things, even ribbons, to raise funds for us. Merelike, we also have a partnership. They call us for an awareness session, and then they attend our walks. For the last 5 years, they've attended, they've bought t-shirts, and we are happy that in their small ways, we are able to make an impact. So, any partners willing to partner with us, they are welcome. But I think what has been a hindrance is maybe the big donors, they want instant results. For patients, a patient can undergo treatment for 3 years. So the money you are given, they want to know how far is the patient. When they hear they are still undergoing treatment, they still need more money, they see as if it's not effective. But I say a patient at a time, one step at a time, and however little we are able to do for a patient, it's appreciated because of that dignity. those that are bedridden, we want to safeguard their dignity. We take to them diapers, we take to them essentials so that even in their last days they can see God through us and we are able to bring their hearts closer to God. St. Catherine of Siena, they've been our partners from 2014 up to now, and they do the counseling to the patients. And partnerships can be in many ways. So when you talk to us, you can tell us where you want to partner.